Okay, now I'm a hospitalist, if you will. I'm an intensivist. All my patients have already been admitted. But out in the community, what's going on? I don't even see those folks until they get so bad that they're near death. But in the community, what's going on with ABSSSI and MRSA? What's happening here?
I think we're starting to see a trend more toward inpatient. We have actually developed antibiograms specific to our emergency departments, and when you compare them to our inpatients, they're starting to look more and more similar. You're seeing higher rates of MRSA, and I think that's causing a lot of the same concerns we're seeing on the inpatient side.
Are we seeing different bugs? Are we seeing a different profile of these patients? You said that it used to be more immunocompromised patients, not so much?
Well, so in the past, you really needed to be special to be infected, particularly with MRSA. That was not very prevalent, but now it's so prevalent in our communities that it doesn't make you special by the fact that you just got infected by MRSA. And what happens is you have such an infection, you go to your primary care physician, you may get an antibiotic such as Keflex or doxycycline or one of those. It may work or not work, but many of those don't actually work against MRSA, and only very few oral antibiotics are actually reliable, and you end up not responding, and after a few days you find yourself in the emergency department when a few years ago this wouldn't happen. And all of a sudden the emergency department is getting to see so many patients that they haven't in the past.
They're getting overwhelmed.
They are, they definitely are, and also they have to make very quick decisions as to what to do with those patients, knowing that they can't keep them in the emergency department, and in many cases the perspective is that maybe they already failed or exhausted whatever we could do in the community.
If you give somebody an oral antibiotic like Keflex, and you send them home and it fails, have you made it worse by ensuring that there's increased resistance? What do you think?
No, I wouldn't say that. So, the main gram-positive bacteria are strep and stuff, and strep would be susceptible to Keflex almost always, and will not become resistant to Keflex if you started someone on Keflex. When it comes to stuff will never become resistant to Keflex if it was initially susceptible to Keflex. But again, if it wasn't susceptible, then Keflex is not going to work. If the patient required some drainage of an abscess, for example, so there are multiple reasons for failing therapy. I just want to mention one more thing. I mean, you talk about trends of skin infections. Another thing that I think we have to take into consideration, and I think it's really a very strong call for action for us, is the fact that if you look at the risk factors for skin infections, they become more prevalent in our society. People are older, they are heavier, they have more diabetes, they become more susceptible to skin infections, and that's one of the reasons people have developed ulcers, and that's one of the reasons we've seen such an increase, and the expectation is that this will continue to increase.
You know, it seems to be one of the counterintuitive issues with the wellness of the American public. We keep people alive longer, we keep people with chronic diseases going further, but on the other side of that, here comes MRSA. Here comes susceptibility because of poor peripheral perfusion. Are you seeing that?
A little bit. I think, you know, speaking back to his point before, I think it depends on the patient that presents, and whether it's a simple cellulitis picture, you start looking at systemic signs of infection, you know, whether or not they're febrile, and then comorbidities. I think that plays a big role into the type of patient we're treating.
You know, when you talk about this sort of thing, and emergency room visits and antibiotics and repeat infections, whenever you talk about this in terms of public health, you come back to money.
Absolutely.
Right, because these tend to be cost sinks. They're expensive.